are so glad that you're here for this webinar today. I've got your four presenters up. Keon, why don't you go ahead and share your screen so we can see the opening slide there, and I'll talk a little bit about some of the housekeeping we're going to do. But the first thing I want to say is that I want to welcome you to this webinar with Independa. A couple of housekeeping things I always want to start with. The first is that we are recording this, and so we will make the recording available to you afterwards. We'll send out an email either late today or sometime tomorrow with the recording. We would welcome questions, and the best way to do questions, if you look at the bottom of your screen, you'll see a little box that says chat. You can click on that and drop your questions in there. You might remember that often when you do webinars with us, there used to be a question and answer box, and we've actually taken that away because it means we've got sort of two ways to field things, and this just makes it simpler to know exactly where we need to be. The other thing I do want to mention at the beginning is that you know, this is really, this webinar is really heavily on content and how to use technology to keep your residents connected in the face of COVID-19. As I'm sure most of you know, Independa does provide some technology for that we think is really the best in class technology. But mostly it's about doing something and making sure you're serving residents. But if you'd like to check out Independa, one of the things that we've done is worked with Keon, who's the CEO and founder, to create a little discount code that we'll make available to you by email. And with that, Keon, let's get started. Keon's the founder and CEO of Independa, and I'll let you do the rest of the introductions. But before we get started, let's do this. If you can open up your chat box, just type in there, you know, where you're from, maybe what your community is, that kind of thing. That would be absolutely outstanding. What kind of a senior living community you're in. So just grab that chat and tell us where you're from. We'd love to hear that.
That's great, Steve. So while you're getting the results, good morning, everyone. And it's great to be with you today during these strange times. We look forward to having a great webinar with you and also sharing a lot of valuable content. Just to level set what Independa is all about, we're about enabling quality longevity, and we believe strongly, passionately that all of us can live and thrive at any age, regardless of our residence, whether it's at home or in a senior living community, with the leverage of technology, simple, easy to use technology, and be at that stage longer, safer, more comfortably. Ideally, not just delaying, but eliminating the next episode or stage of care. Lots of accolades and awards for us. We're not going to spend time on that. I do want to talk about a couple of strategic partnerships that we have, which are relevant to everyone on the call here. We have strategic relationships with LG as well as with Dish. LG has been an investor, longstanding, going on 7 years plus now. We're embedded inside every LG commercial TV. So if you're building new facilities or updating facilities, particularly on the nursing home side, short-term rehab, et cetera, with TVs being provided, that's a great opportunity to have Independa already come in with the TV. On the Dish front, we'll talk more, but you'll see that the Dish boxes, as well as reseller channels and distribution partners around the country have partnered with us to provide solutions into senior living. So let's talk in general terms with respect to COVID-19 and the challenges that it really magnifies from what we see with respect to resident engagement. So question here for everyone in your chat box is, has COVID essentially had no impact on the previous challenges that we all were aware of with resident engagement? Had some impact, quite an impact, or frankly, a ridiculous amount of impact? So I'm going to venture to say most of the answers are going to be the last bullet, but we'll find out, and we'll move on while Steve collects those answers.
Yeah, so we got ridiculous, I'm seeing quite ridiculous, quite an impact, large amount of impact, ridiculous amount of impact. I think that's profound, ridiculous. Yeah, it's just huge issue for, looks like everybody.
Exactly. So the point here is everything we're sharing today has always been the case. We all have been aware of it, but it becomes that much more magnified and relevant. And it's really all about the impact of engagement to the resident, but also, as you'll see, it's about the impact of engagement with your staff, with your organization, with profitability, with friends and family. It's a holistic view. But let's just start with the residents. And here's a couple quotes there. I'll summarize really the probably the most cogent one. The worst cruelty that can be inflicted on a human being is isolation.
You know, one of the things I just want to jump in for a second, Keon.
Go ahead.
Lori LeBay notes, and this is so important, is that the impact on this is not just residents, it's their families too. And that's that's a really key point. So absolutely.
Absolutely. Well, families, staff critically, as well as the organization as a whole. So really, we'll see best-in-class technologies really have to address engagement in a holistic way. It's not just about video chat, although that's obviously a key component. And this gives me an opportunity to introduce to everyone here Dr. Richard Della Penna. Richard joined Independa, myself, over 10 years ago now from Kaiser Permanente, where he led all of elder care programs at Kaiser nationally. He's been on the National Board of Alzheimer's for maximum term. He's one of a very few people nationally mandated by Congress to advise the VA on geriatric issues. So the list goes on. I won't take more of our time, but really just to set the stage about the impact of isolation, whether in senior living or otherwise, and the challenges that we've always faced and now are magnified. So Richard, why don't you go ahead?
Okay, thank you, Keon. Stephen, you just mentioned impact, and I, as a geriatrician and someone who took care of many people at the end of life, one of the major impacts that I see is the way people are declining and the way they are dying today. We're used to people declining slowly with chronic conditions like Alzheimer's disease, heart failure, chronic lung disease, etc. And they died slowly too. But today we're seeing rapid acute declines and rapid deaths. And so that's a very different landscape for me. And I think we all understand what isolation means today, given that we have social distancing and isolation. And as you pointed out, Steve, this is affecting all of us. So our residents, our families, our staff. And whereas loneliness is the subjective distress that people have by not having enough of meaningful social relationships. And I think we're familiar with the expression about being lonely in a crowd. So the elderly and our residents regularly experience loneliness. The numbers for this really vary. There have been many studies done, and the consensus is that people who are living in assisted living, skilled nursing, have even higher levels of loneliness. The UCF study, that's sort of a landmark study, survey of 6,000 people, demonstrated that 40% of people over 60 were lonely, either some of the time or all the time. So during COVID, one of the challenges that we face is to provide the isolation that's required to prevent the spread of the virus, but also at the same time to prevent loneliness and promote practical social engagement. So loneliness can be lethal. I think many people think that older people should be lonely because they're older, but that's not the case. There are so many elderly people who are fully engaged and not feeling isolated, not feeling feeling loneliness. The bad news is that loneliness can create or does create serious health risks. The Health Resources and Service Administration, part of HHS, in a report said that loneliness has the effect of smoking 15 cigarettes a day. We know that's bad for you. Other things that travel along with loneliness are depression, self-neglect, decreased adherence to medications and treatment schedules, also well-documented accelerated decline in function and independence. So we can see that it has profound effects. I think the most telling number is that at 6 years in the UCF study, people who reported themselves as lonely through a loneliness scale had a 45% higher mortality at 6 years. So almost half of the people who were lonely people who were lonely had a 45% increase in death at 6 years. So we can see that it's lethal. And these are all related. Social isolation has a high risk for loneliness. Loneliness has a high risk for depression. So the good news is that loneliness is actually quite modifiable. The most important intervention that the literature reports is to have scheduled contact with familiar people, family and friends. Activities are important, whether I'm alone or living in a senior living facility. So physical, mental, and spiritual activities that are tailored specific to a stage of care and condition. So for example, people who have dementia, moderate to more advanced dementia, really benefit from reminiscence. Also, another important thing is having a sense of contribution, having people listen to me, having people to hear about my life and what I think is important. All of these things are important in modifying loneliness. And again, technology can and must play a role in attacking loneliness. So at this point, Kian, I'll turn it over to you.
Thank you, Richard. So we set the stage that loneliness has been a challenge all along, and now we're talking about really COVID-19 highlighting these issues and exacerbating them. At a high level, we know the challenges are that we have a large number in this demographic and growing. The costs are skyrocketing from a labor standpoint and every other aspect. There's never enough staff, and so that's always a challenge. And everyone wants to stay independent. And really, independence is maybe a misnomer. Everyone wants to be respected and not monitored, but have interdependence, have those social engagements in a meaningful way. And today,
can I ask a question here? I'm actually would love to hear from the participants what they're doing differently in sort of the face of COVID-19 in their communities to combat loneliness right now. And so if you've got some things that you're doing, some cool tips or tricks, we'd love to hear about that. Or even if you tried something that didn't work, we'd love to hear about that as well. So if you could just type that in, that would be outstanding.
That's great. And just for the listeners, Steve is going to jump in and ask questions all along of you, and we'll collect them and share them and so forth. So thank you, Steve, as we go along. There's probably 6 or 7 of them. The challenge has been there's been no platform, there's no way to really centrally manage and fully integrate with the residents all from one place. And that really is what's needed to address loneliness and isolation in an effective way. So it all boils down to 3 things. And this is one of the key slides for our presentation today. And technology really has to deliver in these 3 areas for it to work properly. And each are necessary, but none is sufficient on its own. So what's number 1? Engagement. So clearly, when we talk about engagement, technology has to enable that. That's the vital component to remote engagement and care and addressing isolation. But what are the components of engagement? First, it has to be wide-ranging. It's not just about video chat. It's not just about picture sharing. It's not just about being able to send a message and have someone see it or maybe respond to that message in a simple, easy way. It has to be taking care and consider all aspects of engagement from a number of stakeholders, starting with the residents, and we touched on this earlier. So fun and empowering to the resident, for sure, but also family members. It has to be convenient. It has to be valuable to family members, near and far, from different countries. We have lots of folks saying that when their mom stayed at short-term rehab with our platform, they were able to have a better relationship with her while she was recovering there because of the use of the TV and the platform versus when she was at home. So family, staff, very much so. It has to be easy and empowering for the staff. Otherwise, it's not going to get used. So you have to expect that there's no time, there's nothing new to learn really, and it has to be just a net plus positive. Finally, the organization has to have engagement opportunities into the resident. So we'll talk about and see things like menus and community calendars and all sorts of things, surveys, even work orders. So how do I really solve the problem of engaging my own resident inside the room in ways that I never even thought were possible before? So that's on the engagement side. Then we go next is simplicity. So while engagement is critical, but if it's not super simple for all involved, but absolutely starting with the resident, it's not going to get used. It'll be a challenge for everyone. So starting with designing with and not for. So some of you may have heard that term. What that means is, what are the technologies that someone already knows how to use, and leveraging those pervasively instead of asking them to learn something new. So as we all know, there's more and more usage of computers, there's more and more usage of tablets, there's more and more usage of smartphones and even apps. That's all great, but when you look at the percentages, they're nowhere near even 50%. So when you look at, if someone is 80, 90 years old, and you have a wide cross-section of that in your residence, what are the two technologies that everyone knows how to use? The TV and the telephone. So we think, we strongly believe, I shouldn't say think, that starting from that is the designing with instead of for. So you don't have to go teach someone what it is to go to a URL or to remember passwords or virus scans or not drop a tablet or keep the battery charged and so forth. So simplicity is key, not just from a design standpoint, but the respect of the individual to show that they can use things that they already know how to use. Nothing new to learn, very important from a resident standpoint. The other thing is simplicity really also has to do with integrated functions, so that from a organization and staff perspective, it's simple to leverage one solution and have all these other benefits that I'm going to share with you all in one place. So we believe strongly that's the best practices, because no one wants to buy one solution for, you know, video chat, another solution to send pictures, a third one to deliver community calendars one way, a fourth one to make people aware of menus, a fifth one to do broadcast messages, a sixth one to do a call button, and it goes on. A seventh one to do life stories. And right now, the state of the industry has been that each one of those is a little silo of a solution that someone needs to make a decision, and none of them are connected. There's no central reporting and management and awareness of the same system. And that integration actually creates a future-proof opportunity for simplicity again. So what does that mean to be future-proof? That means if you connect to devices, it doesn't matter if, let's say, the motion sensors from one manufacturer or another, you have one place that they all plug into. It doesn't matter if the scale is from, you know, A&D today and from Omron in 6 months, because those are going to get faster, cheaper, better. So particularly for independent living, if you want to provide empowering solutions for family members to be able to engage your residents and keep them there longer, safer, more comfortably, this notion of connecting to devices and standards and abstracting that for your organization and your staff is a big one, because otherwise, again, you're dealing with individual silos. And of course, simplicity is really at the end enriching your life in a way that's very effective for everyone. So any questions on that, Steve? You want to jump in with a question before I go to the last column? You're on mute, Steve. You're on mute.
Sorry about that. More than that, I'd like to actually talk just, there must be 20 just amazing suggestions, putting cloth bags outside rooms to drop prizes in. Lots of people who are doing various forms of video chat, which are really terrific. Some of the buildings have balconies where they're being able to do visits. They're doing visits where they'll look at each other through the window and use phones to talk to each other. So we'll figure out a way to take this list and turn it into something we can send out to everybody. And there are a couple of them in here that I think we actually need a little bit more information from, but lots of just amazing things. So, but I do think that this idea of the engagement, of course, we know is ideal. And more than anything else, I love the idea that it needs to be simple. I think that simplicity often gets lost with technology. What ends up happening is you can do all this cool stuff with technology, but it gets so complex. And I find myself sometimes thinking that going back to just paper and pencil rather than notepads is better. So I agree, because it means that you can focus on the most important things.
Right. Thanks. That's great information. And last but not least is the ROI for the staff and for the organization. So how do we ensure that there's a business case there, that there's an opportunity to do a lot more with actually less, that the system itself is cost effective. It's super easy to install and maintain. Those are all criteria to have check marks on. Is a platform and not a silo. So in technology lingo, that means that you're not stuck with one siloed solution, but you can actually integrate with other environments. To give you an example, if there's a surveying capability, then it should integrate with other surveying leaders in the industry. So for instance, in Independence case, we have a great surveying tool, but we also integrate with Promatura. If some of you work with Promatura, their surveys would be available under our platform and at cost savings, because you don't have to deal with the paper and the clipboard and the shipping of surveys back and forth and distribution and redistribution back and so forth. So that's just one example. Same thing with menus, same thing with community calendars and so forth. So that's where you really want to sit and make a choice that it's not a gizmo or a gadget. It's not really consumer centric. It's designed for the enterprise and brings both top line and bottom line benefits. The top line benefits are related to the brand benefits, where you can differentiate, showcasing this technology to prospects, and also in terms of bottom line benefits would be the staff efficiencies. So just to give you an example, we all know the wellness director's day is spent roughly 70% of the time calling folks and knocking on doors to show up for activities they signed up for. And that's even before COVID. What if those activities were all on their TV and they can actually do search on it easily and they can pick them, and then now it's on their own personal calendar. They get reminded, family members see all that, again, reducing calls in, and then the staff member can spend more time designing the activities and doing other, productive work, including spending more time with those who need that time with them. So that's all on the brand, on the ROI side. So that's really the best practices, in our opinion, on technology that has to be pervasive in its engagement, as super simple to use with technology that people already know how to use. And think about it, if you're an organization and you want to do a broadcast message to everyone, if you start thinking about everyone who has computers, everyone who can use a tablet, everyone who has a smartphone, everyone who goes to an app, that just goes out the door. So what is the technology that everyone knows how to use? And so that's the TV, in our opinion, and in practice as well. We have, it's not a religious discussion for us. We actually can run easily on a tablet or a computer. So FYI, everything you see could be running on any device, really. But we feel and we see that the TV is such a different experience, including things like just the form factor of being able to see pictures or being able to have conversations or read things or look at menus, etc. Where if you have macular degeneration and if your eyesight's not the same, or if you want something to be loud, or if you're already watching TV as it is. We also integrate with Alexa, and that also allows you to navigate in our system, as well as get a lot of engaging features right through that device, the smart speaker. The two remotes you see on the left, one is the Dish remote. So this is where I'll share with you that Dish has integrated their voice-activated remote control to run our platform. So you can actually engage us with up, down, left, right, and I actually have hot buttons to bring up Independa. If you're on any of the Dish systems, you'll see in a slide or two. And if you don't have Dish, no problem. We have a super simple clamshell, up, down, left, right, backlit, color contrasted remote control that you see there. So those we think are the right tools to bring engagement, simplicity, and ROI to a community. And the individual features that we think are critical, you'll see here in the list. I won't go through all of them, but I'll mention they're in three large sort of value pillars. One is around personal engagement. As Richard mentioned, the ability to have meaningful connections with those you care about and who care about you. And so simplifying that is really valuable. And everything on the left could be from a staff member, could be from a professional, could be from a nurse, could be from an outside doctor, but also obviously could be from friends and family. Organizational engagement, you see a list of all the different features that come with the platform and the system for any organization. So you get to really leverage one way to engage your residents, which previously didn't exist in as broad a way as we're talking today. including delivering videos for compliance, for education, and web content. So you can put up websites, etc. So organizations can actually build their own group of videos as well as activities that they can deliver right on the TV, making it much more competitive and a differentiator to others around. And last but not least, this notion which is really important around integrated remote care. So tying in with different biotelemetry devices and motion sensors and everything else, if and when the time comes for that individual or the organization to want to get into that, the platform supports it. You don't have to start with that at all, but in some cases, like in independent living, that's a great addition to have. In other cases, like in memory care or assisted living, it's not that relevant because there's more care being provided. So with that on our side, I want to introduce Joe Betancourt. Joe is a friend and a partner. He's a long-time expert in senior care, having multiple businesses in the industry and also about technology in the industry. And he's a partner of Independa. And I'll hand it over to Joe to talk about the two businesses that he has and how with Independa he can help your organizations and the considerations that he's going to share with you.
Thanks so much, and thanks for having me here today. Yeah, I've been in the aging community for over, 20 years now in different settings. I own two businesses, Interim Healthcare franchise in East Bay, Walnut Creek, California, and I'm a regional owner for Live to Be Healthy. I'm going to talk a little bit about both of those businesses and how we're leveraging this technology in today's age to be able to make it the maximum efficiency and be able to reach out to our clients and or our participants on a very effective basis. Currently for Interim Healthcare, we're using this platform as a care management or wellness program. It allows us to check with several clients. In 1 hour, for example, my care managers can reach out to 4 people and do a quick wellness check in the morning. So in 4 hours, that care manager can reach out to 16 people, where typically they may only see 1 or 2 people in that same time frame. And really what it's doing is creating a positive contact in somebody's life, a face-to-face contact where we can evaluate and see how somebody's doing. A picture's worth 1,000 words. And so that contact and that face-to-face is something that starts everybody's day out. We call them morning check-ins and evening check-ins or PM check-ins. And so it starts their day out with a purpose. You heard Richard talking about social isolation and how that affects people, and just sometimes having a purpose and getting up in the morning and having something to look forward to can change a person's outlook on the whole day. The other way we're leveraging it is with the reminder care or the red flag alerts. We have the ability to be able to find out if a person maybe forgot to take a medication reminder, if there was an appointment that was missed, a doctor's appointment. It could be that maybe a blood pressure alert came or popped up. The blood pressure was not as where it should be. It allows us to contact or reach out to those people on a proactive basis and be able to take care of them versus reacting to situations or phone calls as they're calling in. We're actually calling and reaching out to them. And it's been a positive experience, not only for our client base and our population, but also in the assisted livings and in the independent livings, because it relieves a lot of the calls that the front desk people get or their activity directors get during the course of the day. Just because of that social isolation impact part, we are actually reaching out to them. We found in our own business, people would call us sometimes several times a day just to talk to somebody and realize that it was the loneliness aspect. And so rather than having them call us from a loneliness aspect, we're reaching out to them and calling them and actually having a positive impact. It's been really, really good. I think the game changer for me with Interim Healthcare is hearing that a person that has limited mobility isn't going to miss an event in somebody's life again. The grandchild's graduation that they were afraid to go to because they were fear of falling, or maybe they're not able to get out to that soccer game because they were worried about walking across the field. This technology will be able to have that individual with them right there at the event and never miss out on anything in the future. So that in itself, I think, is a key factor to this, as well as all of the other bells and whistles that you're going to hear about this today and in the future. Live to Be Healthy, a standard contract with Live to Be Healthy is 3 classes a week. And during those classes, we get the best results with our certified fitness instructors teaching those classes. How we integrate with this program and this system is working with the activity directors or the community wellness person to leverage the system by posting classes and all of the activities that are going on in the community. And when you have an opportunity to do that, along with a positive statement starting the day, a person can actually put these program or these classes and set them up as an appointment with a pop-up reminder. And what we've seen is far more participation in all activities through the communities. A little pop-up reminder when you're sitting there watching TV says, oh, I forgot about that. And boom, you're out there, the residents out there, the participants out there, and engaging in things that maybe they might have slipped or might have got by them. So those pop-up reminders are huge. The other way we're using that, if it's a no-show for one of the activities that's going on, it's kind of a red alert trigger that maybe something's going on with that individual. So in the fitness classes, we're going to use that where the trainers are actually calling up those individuals to find out if they're okay, check on them, and or if they're not, maybe transfer that information over to the community liaison or contact person. The activity director can also use that to indicate which individuals need a little more help versus the ones that are not in need of as much help. So yeah, it's been very, very effective. It's something that we're finding that is getting, like I said, more activity participation throughout just because of those reminders and those things that are popping up in the calendar schedule. And again, a picture's worth 1,000 words. I definitely say if you haven't seen the whole system to look at it, because it is the efficiencies in it alone, especially with what we're going through right now with this flu season. Flu seasons aren't uncommon for communities. Usually they're on lockdown 2 weeks out of the year anyway. But this year we're seeing something that's different and we don't know what the future is going to bring. And so having the technology in place to be able to make sure that you have the ability to overcome that, I think is key, and it's huge. As you mentioned, it's a differentiator in all areas, and this is something that can be accomplished through this system.
Great, thank you, Joe. And Joe's services are available to those on the call as well. So he can work with activity directors and extend those activities into the room using the TV. So just a quick review of what it is that we're talking about. We really turn a commodity appliance and transform it into a replacement for computer, a tablet, et cetera, that we talked about. Nothing new to learn. It's important to note there's no input change, there's no channel change. You don't have to go to a channel, you don't have to learn anything new, and you don't have to go to an app deck on the TV. So there's an overlay function. The box that you see there, the little candy bar, takes HDMI in on one side, HDMI on the other, so it's super simple to install. And there's a camera that goes on top of the TV for everyone. The question is going to be, oh, well, how do we know the camera's on? If it's ever on, you actually have a red light that goes on. And also the person in the room has control over whether that camera gets turned on or not. So that's on that view. And of course, we talked about with dish systems, if they have Wally, Joey, or Hopper Duo, the voice-activated remote actually launches independent as well as has the functions, the button functions running. And also important to mention Alexa. This device has been around for a number of years now. We've been waiting for some time to have it be sort of ready for prime time for our demographic. And we feel it's there now. There's a lot of additional enterprise features and improvements in the speech recognition and tie-ins to everything else that we do. So we're really excited about the opportunity to use this smart speaker system to do navigation, to call things, and to ask for, like, what's my next appointment, even get reminders on it and so forth. So again, it's all about simplicity. And to do that, we want to make it as simple as possible, and leveraging all sorts of technologies to help organizations engage with their residents.
Ken, I've got a question for you and a question also for the audience. So the first question is I'd be curious with the audience, how many of you are currently using Alexa with your residents, your community? And I guess the way to sort of maybe ask the question so we can have an understanding is, are you using Alexa? Not at all, or what percentage of your residents are using it, or do you know? And then we actually have a question is, does this work with the Google Home as well? But so I'm going to start with that, and then I'm going to give you one more question, and then I'll let you go back to talking, Keon. So the other question I have is, can you, if a resident has an Alexa, can I set it up so that I could actually broadcast through that and say, hey, there is cocktails are being served at 4 o'clock. I mean, I know you wouldn't necessarily be bringing people together right now, but can I use it as a broadcast device?
Yes, you can, number one. And number two, just let's talk about broadcasts as a feature to begin with. So in our broadcast options, one thing is to do live broadcast. So you could, broadcast the Easter Day Sunday celebrations that nobody could go to onto everyone's TV live. You can also broadcast any kind of video. So it could have been recorded, or it could be other things. It could be the CEO's message. It could be, daily updates on COVID, you name it. And those could be broadcast to everyone. A third is you can also broadcast text messages. So it's a warning, a hurricane's coming, et cetera. And those are all there. So the text would be the appropriate one for, I want to not mention the name because the speaker is sitting right here. It's going to start talking to me. So with the Amazon Smart Speaker, you can also broadcast the text messages, but obviously not the live stream or the video.
So any privacy issues with Alexa?
Not really, because everything is HIPAA compliant into the person's residence, and we're not broadcasting any personal identifiable information. So for instance, if it's a reminder to take medications, it would just say, here's a reminder to take meds. It doesn't say what it is that you need to be taking. So it's mindful of that. Same thing on our system. So if you're on the TV and it pops up, it's your afternoon medication reminder, you would get to accept, decline, snooze, or ask for more info. If you ask for more info, it will then tell you what it is. But otherwise, if someone's sitting with you, you have the control of not sharing that information.
Perfect.
Any other questions, or should I continue?
Nope, that's it.
Great, thank you. You had a question about Google Home. So we don't currently integrate with Google Home, but it's easy to do that as well as the Apple smart speaker. It really depends on the next opportunity in a senior living community. So if there's an opportunity there, we can look at that. And as well, like I mentioned, the smart speaker from, I should say the voice activated remote from Dish, in fact, integrates with Google Home. So from that standpoint, through them, we're already integrated with the Google voice activation.
Great. I actually have one more question for you. With Alexa Speaks, do you get complaints that it becomes intrusive to people's lives?
We don't have enough experience with that just yet. And like anything else, it depends on how much you use it. So if everyone uses it all the time and it's just going off all the time, I would imagine the answer is yes. But no, we don't have those comments yet.
Okay, great. You're up.
Okay, so just we're perfectly on time for me to be able to share just a quick demo with everyone here. It's always nicer, as Joe was saying, to see things instead of just talk about them. And so I want to show you this screen. Imagine this is your TV. And obviously, given the 5 minutes or so that we have, there's not enough time to show you everything. But just to get a sense of it, this is as simple as it is to engage with the platform. And again, this could be on a computer running as an app. This could be on a tablet. But on the TV, it's a whole different experience because of the size, and you have all these functions. This could be thought of as even a small soft PERS, let's call it. It's not triage in the back end, but you can have folks get notified of things. Under social, I can go and read messages. I can view photos. For instance, Richard talked about reminiscence therapy. I can go in here and maybe put on a slideshow. And now the staff member could actually walk away and come back in 30 minutes, and it loops through all these pictures and literally clinically proven to help with memory and dementia. Coming here, I can look at messages the same way. Again, everything is through a remote control, or like I said, navigation through the smart speaker. I can do video chat here. I can actually call Richard. I can call friends and family that have been set up for me. So there's no solicitation. People are not going to come in and ask me to go travel the world with them if I open up my bank account, because it's all managed by friends and family. And I can even look at my calendar right here. So I could see what's going on. I missed my 9 a.m., 10:30. I still have a chance to go actually okay it. It actually would have come up at 10:30, but I didn't okay it. So I can go in and confirm that I measure my blood sugar. So that's great.
Yeah. So quick question for you from somebody who said they've used similar devices in scattered independent living home sites, but they found the process of installing it and keeping it maintained and, you know, people struggling with it to be a big challenge. Any thoughts on that?
Well, I think that's the challenge is the term similar devices. So I'd have to chat with them individually. But for instance, the whole point that we were making, we were the first out with a tablet, let's say, and we just gave up on that format. So I'm not sure if it was a tablet or a computer, but that's a major challenge, is to maintain someone, you know, having the tablet, for instance, charged and having it, the gestures learned and so forth. It's always important to sort of roll out technology in a meaningful, sensible way. But at the end of the day, the simplicity of the TV really wins the day. So when everything's on the TV, if I do nothing and you see the white screen, that's me watching Matlock or Price is Right or whatever. My life doesn't change at all. I don't have to go somewhere else. I don't have to bring something to me. I don't have to learn anything new. And something can be just brought to me as a notification or a reminder or a video chat session, etc. So I don't know, Richard, if you have your system on, but if you do a quick video chat, people will see how easy it is to even answer a video chat while I'm watching TV. Again, there's nothing whatsoever to learn. That's the key. So, and I'm going to see if I can show you.
Canada?
There we go. So Richard just called me from his mobile app, and it could be from a browser as well. And I'm watching TV. And if I accept, you'll see Richard will come on. There'll be a lot of feedback, so I'll get out of it pretty quickly. So that's me. And that's Richard. Hey, Richard. Thanks so much.
You're breaking my ears. There we go.
So I just hung up.
Yeah.
Go ahead.
So a couple more questions. Is it available in Canada?
It is available in Canada. We're actually working with a large telco there as well. And we're looking to have distribution partners and resale partners there. But from a functionality standpoint, it's available.
Yeah, and then can it be used outside the community, like with home care and that kind of thing?
Yeah, that's a great question. I appreciate that question, because we built a system really around the person, not an industry. And so absolutely home care, everything that you see here, if I go here, this is where the community has these functions. It's a community calendar. Many home care organizations would also have sort of a neighborhood calendar that they want to extend into the virtual wall of their providers. Or their clients. So here I'm looking at, you know, if I want to look for something, maybe I want to add combat karate, super simple. I add it to my calendar and now it's mine and I get reminded. But you look at some other things like a dining menu, that wouldn't apply to home care. So you just basically turn any function that doesn't apply off, and there's only a couple. Really, dining is one. Surveys definitely apply. So if I go here and I want to take a survey, there's a new one here. I start this, yes, and then I see 1 of 6. I was kind of satisfied. I took 2 of 6, and then I get interrupted. So only 33% of that was done. If I come back, I can retake it or resume. Again, that's very valuable to home care. The type of work that Joe was talking about, it's really all home care centric. We just did a podcast with Tim Rowan, who has a Home Care Tech Watch, and you can go on his website and listen to that with one of our home care partners out of Sonoma County. And she talks about how at COVID time, but in general, the system is really saving the day in terms of engaging with folks from a distance, especially in rural America. Even if you want to go in here from again, doesn't apply to home care, but I can go in and have work orders right on the system. And even a staff member could use the system to do that. So I just sent a message that defined that. And last but not least, on the community side, I can actually go play videos. So you can build a library of videos. In this case, I'm going to play a video from YouTube, and it's on fall prevention. So you'll see how easy it is. And somebody just basically clicks on that, and here's a guy who comes in and talks about fall prevention.
Walking. It's an activity we almost take for granted. Just put one foot in front of the other.
Great. Any questions on those so far? So this is an area where, if you remember the circles, this is where the organizational engagement is under the community icon here. A couple other things. Go ahead.
So is it, can you do a live activity? Could you do like I don't know, like a Zoom or a Facebook Live or something like that?
Yeah, absolutely. So that's the live stream I mentioned in broadcast. That's the live stream in broadcast.
Right.
So, and Joe's group can actually outsource that for activity directors, or you can leverage a system and outsource that. Somebody from their home can broadcast to everyone. Also really important, there's a lot of other features. There's not time right now, but things like groups. So someone can belong to the diabetic group and they get all the broadcasts for diabetic, they get all the surveys for diabetic, they get the diabetic menu, they get the thresholds and alerts for diabetes members. And so it helps you manage things in a big way, easy way. You also have music here, so you can see you have different music stations you play, and I can deliver videos right as you know, into someone's room as a family member. So this could be
This is
Billy,
Angela.
little Billy playing soccer. So that's a very quick overview. Last but not least, you can use the TV or your mobile app or the smart speaker to enter information. So I'm going to just do a little live. Alexa, open Independa. There we go. So Alexa just did that. Alexa, watch TV. Alexa, open Independa.
Independa is open. Say commands to navigate and interact with your TV.
Left.
Going left.
Select. Select.
Okay.
Watch TV.
Closing Independa.
So this just showed you, I didn't have it loud enough, so I had to redo it. But so I just navigated, I selected, and I went back to watching TV without a remote control. Okay. And Steve, last but not least, I just want to show folks this view, which is our mobile app. So if you're a staff member, you basically see everyone under your care. But if I click on, you know, Mercedes, I just see Mercedes here. So if I'm the daughter, I just see Mercedes, and it's really simple to, you know, send photos, do messages, etc. If I wanted to take a photo, I can take one right here. I'm going to add one. I'm going to take it. So this is live right here. And by the way, that's our box. So that's how easy and simple the box is. And that's the device itself. So I could show everyone the device. There we go. Right there. In and out. Okay, so I'll take this picture. I'll use it. I'll choose it. Thanks for the great webinar, Steve, exclamation point. And I just posted that. Okay, Steve, do you have any other questions? Well, there we go. It just came in.
I don't. I think we've gotten through them as we've been talking. So I think we're in great shape here.
Perfect. So notice here's the picture that I just sent. If I go here, I can see the caption. I can actually respond to it. If I want to respond, I just click here, and that's it. So if I go back to my app, you'll see when I come back to social, the picture is there, the little eye is there, which means they saw it, and that's the happy face we just sent.
So a couple more questions for you here. The first is, does it have to be purchased for an entire community? Can be done independently by, say, an individual resident or just a few residents? And then the question is, how do you get pricing? And we will get that information out to you by email in the next day or two.
Right. So to answer the first one, really a lot of the benefits that we've been talking about don't work at the opt-in model. And the opt-in is the resident has a choice of becoming a client or not. Basically, broadcasts go out the window, menus, surveys, you name it. So the organizational benefits go out the window. Now, our home care partners go into senior living communities, and either in the case of Steve, in the case of Joe, he can actually help with staffing as needed. He can also set up the entire community, but he can also have his own clients maybe inside a community that use Independa. So that would extend a virtual neighborhood, so to speak, inside communities. But when we're dealing with a community as a partner and a customer, we really advise them not to do an opt-in model because they won't see all the benefits and it's a number of individuals that don't have all the benefits of a central management. The broadcast question, for instance, you're broadcasting only to 20% of the folks or 40% of the folks. So everything gets diminished.
Gotcha. Perfect. And I think that with that, I think I'm done with questions. This has been terrific. Any last words?
No, just, this is the new normal, and we talked about COVID, and we started with COVID, and this too shall pass, but I think we all agree society is going to change forever, and how we might consider engaging our residents is going to change forever. And I was just reading today in England, 2,000 of their senior living communities have come down with COVID. So we're all, challenged right now, but I think overall it's really important to help with the isolation and loneliness, and also, efficiencies into the organizations that we talked about.
Great. One final question for you that just came in, and then we'll be done and say thank you. But the question is this, I think the question I get is right. Do they have to, if it's used in a home care setting, do they have to use Dish, or can it be used under any TV provider?
No, I appreciate that question, because it's a critical one. No, we are totally agnostic. And any HDMI in, so any TV that has HDMI, which is the last pretty much 15, 16 years, and any feed that comes in, including, by the way, if it's coax going in, there's another device that takes it in coax. So no, we don't need to have Dish. They would just use our remote.
Great, thank you. We are at about out of time, and so Keon, this has been terrific. Learned a lot of stuff. We'll get some email out. There's a lot of chat information we'll get out to you as well. So Joe, Richard, Keon, thank you. It's been terrific. Audience, thank you very much. I wish you the very best. I know these are really difficult times right now with the COVID-19 in so many ways. And so our goal is to help you serve your residents, your families, and your teams better. So again, thank you very much.
Everybody stay safe.